Good afternoon. Dr. Markle of Centeno Schultz Clinic, and today we're discussing a condition called Baxter's neuropathy. Is one of the many things that can create some chronic and intense heel pain. So we'll be discussing what exactly causes Baxter's neuropathy, some symptoms, as well as some underlying issues that can create it, and in addition to discussing some regenerative medicine and non-surgical interventional techniques for successful treatment of Baxter's neuropathy. So what is Baxter's neuropathy? It is an entrapment syndrome similar to carpal tunnel syndrome in your hand. This is an entrapment of a nerve in your foot, right around your heel on the inside part. It compresses a branch of your tibial nerve called your inferior calcaneal nerve, and that is the Baxter's nerve. Now, the inferior calcaneal nerve is the first branch of the lateral plantar nerve, which is a branch off of your tibial nerve. It lives between a muscle belly called your abductor hallucis muscle, as well as the medial calcaneal tuberosity, which is a small bump where common heel spurs occur in the foot. Now, if we look at the way the nerve travels, so the tibial nerve comes down. It then branches into your medial and lateral plantar nerve, and then the nerve branches again into that Baxter's nerve. It goes by this muscle right here, which is your abductor hallucis muscle, and then after it gets past that muscle, it goes adjacent to your calcaneal tuberosity and your quadratus plantae muscle, which is at the base of the foot right there, and here's the nerve going right under it, and then it traverses posteriorly around. Sometimes there's common heel spurs in this area, and those three areas are the main regions and potential entrapments that create the entrapment itself. Now, causes of Baxter's neuropathy, sometimes you have some predisposing conditions. One such as muscle hypertrophy, meaning if one of those two muscles in the foot become overworked and hypertrophied, they can compress the nerves traveling around it. Obesity can be problematic. Then foot and ankle conditions such as hyperpronation or flat feet can create some compression of that nerve. If you have some bone spurs that created from plantar fasciitis or just irritation around the nerves, that can also create some bony compression of that nerve. Now, symptoms, if we're looking at heel pain in general, a common diagnosis has always been plantar fasciitis. Now, plantar fasciitis typically, historically, has been pain first thing in the morning. You have pain directly into the heel bone. That first step or two in the morning become excruciating, and it loosens up as you stretch out the tissue. Now, Baxter's neuropathy is the exact opposite, meaning you really don't have any pain in the morning, but towards the end of the day, meaning you're walking on a nerve that's getting irritated, so the more you walk on it, the more that nerve gets irritated, so pain tends to be at the end of the day. Irritation of that nerve can create some paresthesias, meaning numbness and tingling along the bottom part of the heel. As well as from an examination, if you palpate along the course of where the nerve is, you can elicit and aggravate the patient's pain and replicate it. Now, if you have these symptoms, how do you prove it's Baxter's neuropathy? You can get an x-ray that can show the pathology of a potential bone spur in that area, as well as an MRI can show if the muscles have hypertrophied around it, causing some compression of that nerve, as well as compression of the nerve does create some fluid and inflammation around that nerve and some thickening of the fascia itself. Now, how do you treat Baxter's neuropathy? One of the common ways would be medications. So typical, your primary care physician or orthopedic physician starts you off on some sort of anti-inflammatory, or if you describe some burning neuropathic like pain symptoms, they'll put you on a neuropathic pain medication such as gabapentin, Lyrica, or a host of any other neuropathic medications. If you have any underlying issues such as the flat feet or hyperpronation, there are foot and ankle braces. They can help take some pressure off of the nerve. And if all those fail, then injection-based treatments would be corticosteroid injections, where if there's any inflammation around the nerve, those steroids will help shut down that inflammation. But the problem with this, long-term wise, it actually is toxic to the nerve cells, so it could potentially make those symptoms worse long-term wise when it does come back, or it could create some damage to the muscles or tendons around it, also re-aggravating that area. Opposite of that would be a surgical treatment, such as surgical decompression. Now, here at Centennial Shoals Clinic, we pride ourselves in and some of the founders of the field of regenerative medicine, and utilizing regenerative medicine such as platelet-rich plasma in the form of platelet lysate. We've been able to utilize this in treating nerve pain for many years. We have published multiple papers such as sciatica using PRP epidurals in the extremities. A lot of times we use musculoskeletal ultrasound to hydrodissect the nerve with the platelets, and that accomplishes two things at once. One, we're creating some space around the nerve that was getting entrapped, and two, we're putting growth factors around the nerve to help those nerves repair. And if one of the issues is potential bone spur, then we can also utilize a technique called a tenax osteotomy, where we take a small device under ultrasound guidance and actually break up the bone spur and remove the bone spur subcutaneously or percutaneously, meaning through the skin, just with a simple needle. If we look at this video, we can see the nerve in the elbow right here, and here is the bone spur, and we can see the machine under ultrasound guidance. I'm breaking up the bone spur, and this gentleman was having intense pain in the elbow as well as numbness and tingling. Within probably a week or two, he was nearly asymptomatic, and the pain has not come back since doing this procedure. Again, this was a combined tenax procedure to remove the bone spur, and then utilizing the PRP as an injectate to hydrodissect the nerve around it and give that nerve some space around it. So if you've been dealing with any heel pain issues and numbness and tingling and potentially been diagnosed with Baxter's neuropathy, give us a call. We're happy to evaluate you either via telemedicine or in-person evaluation and discuss potential treatment options and further evaluate you to see some of the small details, exactly what's causing some of your symptoms. Thank you and have a good day.